Hey guys, how are you all? I hope you all are doing great. So, this video is all about COVID-19 vaccination and women's health. These days I've been getting many messages asking about like I'm pregnant and I'm breastfeeding. Can I take COVID-19 vaccination or not? And will it mess up with my fertility, and which vaccine is safer, and what are the side effects of vaccination? All this. So, this video is like up to date to the best of my knowledge, and I would like to share this evidence and science-based information with you all. As we all know, CDC and Scandinavian many reports have confirmed that COVID-19 can have a daunting course in pregnant women. So, which pregnant women should actually be vaccinated? Because many people are telling COVID-19 vaccination is contraindicated in pregnancy and breastfeeding, which like who are the women who are actually supposed to get vaccinated? There are two groups of pregnant women who are actually supposed to get vaccinated. The first group are with immunosuppressive conditions and who make them clinically more vulnerable to an extreme course of COVID-19. So what are these conditions? Like people with diabetes and other medical problems, with renal and organ transplantation, who are with immunosuppressive drugs for other reasons, who are on long-term steroids, who are with heart diseases. So all these people are basically immunosuppressive, and they don't have the fighting mechanism for their body to fight any infection. So these people are at a high risk of getting affected with COVID-19, so they should get vaccinated. And the second group of people are the pregnant women who are healthcare workers, and because they are working frontline, getting exposed to COVID patients day in and day out. So these also should be vaccinated. American College has told that COVID-19 is not a contraindication in pregnancy, provided it is an emergent condition for the above people. Like these two groups of people, it has not told that it is contraindicated. So if you are pregnant and if you are offered with COVID-19 vaccination, whether to take the vaccination or not depends upon your choice. But this information which I am going to give you helps you make an informed decision whether to take the vaccination or not to take the vaccination. So here are the benefits of taking the vaccination and risks of taking the vaccination. Coming to the benefits, it is always better to get vaccinated than to get infected with COVID-19, because COVID-19 in pregnancy can have a bad course also. Like many people are asymptomatic, but there is a bad scenario for COVID-19 in pregnancy. It has increased the ICU admissions for the mother, and it has also shown to cross the placenta and shown effects of poor fetal growth, intrauterine death. We have seen case reports as such. Okay, so it is always to be on the safer side. Getting vaccinated is better than getting affected. And once you get vaccinated, there is a high chance that you are protected from the further exposures of COVID-19. Okay, and also the other benefit is you cannot get COVID-19 from the vaccination, because this is not a live virus. So you are safer. Live virus will merge into the body and make you more infected, whereas COVID-19 is safer because it is a non-live vaccine, and it is equal to any other non-live vaccine like influenza and whooping cough, which are considered safe in pregnancy and breastfeeding. Coming to the risk, we really don't know the safety and efficacy of this in pregnancy. Okay, because the testing trials have not yet been finished, and we really don't know how it is. Okay, and we really don't know how it actually works the same as in non-pregnant women. We don't know the efficacy also, and also we really don't know the downsides of vaccine in pregnancy, because nobody have studied about the downsides like miscarriage rates, adverse effects to the baby. All these are not studied yet. So this is all this evidence has not come up yet. Okay, but there are many healthcare workers who are pregnant and who have taken the vaccine and who have delivered healthy babies. Okay, so just be cool on that. Okay. Second question I've been getting off late is, I'm breastfeeding, what if I get exposed with COVID-19? So if you are breastfeeding and if you get exposed to a COVID-19 patient, or if you have a spouse with COVID-19, your body will try to protect yourself first by forming protective antibodies. So these antibodies will cross through the breast milk and give protection for your baby. So if you're breastfeeding, and you got exposed to COVID-19, just don't break your head about your baby, just chill and relax. Okay. And regarding vaccine safety in breastfeeding, again, no safety trials have proven that it is safe in pregnancy and it does not excrete in breast milk. However, it is better to get vaccinated than to get affected with COVID-19, especially in the above groups, as in pregnant women, like one with immunosuppressive conditions and one who are health line workers. Okay, this is the second question I get mostly. The third question I have been getting is, will it mess up with my fertility? Like, will my fertility be affected? The answer is like no. I have not seen any infertile people, especially like COVID-19 vaccination and getting infertile. Like, this doesn't make any sense to me. But however, I would like to share an evidence-based theory that COVID-19, although you are like, people are asking me how long can I wait to become pregnant if I get vaccinated. So this is most important question which I actually wanted to highlight in this video. So if you are taking a vaccination and if you are worried like you have to postpone the pregnancy or not, then here is the answer. See, COVID-19 is not a live virus. It is not a live virus. That means the viral particles of the virus, the RNA of the virus doesn't mix up with your blood cells and doesn't alter the course in pregnant, doesn't alter the course. So basically, if you are taking a vaccine, that means you're protected. You will not get further disease with the vaccine itself. So as such, vaccine is safer and it is a live vaccine. So even if you are taking the vaccine and if you are pregnant in the first 1 month, the embryo will not have any attachment to the mother and the baby. It is only the placenta which forms a blood connection from the mother and the baby. So placenta takes 8 to 10 weeks to form in the womb to get a connection from the mother to the baby. So even if you take the vaccine now, you have 8 to 10 weeks. So embryologically, it is safe. Okay. So, and the fourth question which I am getting is, will it alter my menstrual cycles? Many women have asked me. See, it doesn't have any effect on your menstrual calendar. Only thing is, this vaccine is with a lot of stress. Also the COVID-19, which can mess up with your cycles. Okay. And also like I've been getting which vaccine is the best. I've been getting questions like which vaccine is the best. See, according to the evidence and all the like updated information, we have three virus vaccines for this. The first one is Novavax and Pfizer and also Moderna. Novavax is is like the mechanism of action is different from Novavax and the Pfizer and the Moderna. Novavax is a viral protein vaccine which has already formed that spike protein. The spike protein of the virus is already formed and it is being injected into the body. Whereas this Pfizer and Moderna, it will have the viral RNA which will mix up with your immune cells and make up spike protein in your body and then get acted. So these are the basic differences. How does the efficacy matters here is like, see, there are only animal studies testing which is better and which is not better. The first thing is like Novavax has been studied in animals which have shown that it stays in the body for a longer time, and they have tested exposed animals after vaccination in which there is no viral load detected. That means you are 100% protective. Whereas Pfizer, they have noticed that it gets cleared from the animal's body very faster, and there are chances that you might get affected again even if you are vaccinated. Okay. And also like the questions which I have been getting is, once if I'm vaccinated, is there any are you sure that I'm 100% protected? See, as told, we have only phase 1 and phase 2 trials in the animal. And the last question which I have received is like, I have already been affected with COVID-19 and can I take the vaccination or not? See, once you are affected with COVID-19, your body will have a natural immune response and protection until a window of 90 days. But after crossing the window, 90 days window, you are again susceptible to COVID-19. So it is always better to get vaccinated even if you are already infected with COVID-19. So how long should I wait after my exposure with COVID-19? This is what all you ask. So once you are affected with COVID-19 and you are asymptomatic, you can wait for just 3 days after the asymptomatic period, or once your quarantine period is over, you can get vaccinated. There's no need to wait until 90 days. Okay. And so some people have asked me about the schedule. This is basically a 2-dose vaccine which is 21 days apart. Okay. So I hope I have cleared most of your doubts on COVID-19 vaccination and women's health. So if you have any further queries, or if you really wanted to know anything else about this, I'm happy to know about that in the comments. You can subscribe to my channel for more updates. My next will be on HPV and flu shots in pregnancy, and stay tuned. Thank you.